My name is Robert Brick Campbell. I'm a medical doctor trained in the University of Vermont. I did my fellowship after medical school at the Brown University in Providence, Rhode Island, and then went on to do a fellowship at the sports medicine clinic known as the Curl and Jobe Orthopedic Clinic in Los Angeles. From there, I came back east to set up practice here in Virginia Beach. My background is sports medicine. I did a fellowship in that specialty, that subspecialty in Los Angeles to get better at treating high-level athletes, really all kinds of athletes, and give them the best possible care using cutting-edge technology. We have developed our practice here in this area to take care of all patients who have knee and shoulder problems. And as part of that practice, we do offer knee replacement surgery. I use that same sports medicine philosophy to try to get my patients the optimal outcomes after total knee replacement. That philosophy is to try to give them the best, most natural knee we can that gives them the most function and hopefully longevity over the years. I think that this philosophy is in keeping with using a conformance implant for a number of different reasons. But that whole philosophy of trying to get a person to be as functional as possible at such a high level that they can do almost anything they want to do within reason is the driving force behind our practice here. Of course, knee replacements are not designed to be jumped on or run with, but almost anything short of that is certainly reasonable as long as you can tolerate it. We get a number of patients through here that are looking specifically for certain treatments, have certain problems. We tend to see a lot of patients who have been elsewhere before they come here. I think in large part because we don't do an emergency room practice. We don't take people necessarily off the street. Of course, we will if they come to our office, but we don't see a lot of referrals from the emergency room because that's not part of our practice at this time. So we tend to get patients that have been to see maybe that first doctor they saw out of the emergency room, and maybe things haven't gone as well as they had hoped, or they're looking specifically for something that a certain surgery or technique, or talk to their doctors or their friends, their family, and they have heard about us through the community that we can offer something that may be more closer to what they're looking than maybe where they've been before. So our main focus is trying to tailor the experience and the treatment to that patient. Not everybody that comes here needs surgery. Most people that come here don't need surgery. But when they do need surgery, we want to try and make that surgery work the best they can for them. And myself, as well as my partners, are people that are going to stick with you to try and get you through whatever issues you may have. If you do well, that's great. But if you don't do well, we're not going to run away and pretend it's not a problem. We're going to face it head on and deal with it the best we can and get you the right treatment that you need. When you come to see me for the first time, your preparation really depends on what you've been through already. If you have not seen a doctor, then there's very little you need to prepare with or for, except for to bring your best recollection of what your pain, how your pain is caused, what symptoms you have. Try and remember when it first started, why it happened. Was there an event, an injury, an activity that began this problem? What treatments have you had for it so far? All that information is something that we want to know about. If you've had treatment before, what treatment was it? Was it surgery? Did you have injections? Where were the injections given? What kind of injections were they? How did they work? Did they work all the time? Did they begin to diminish over time after you got multiple injections? The more information you can give us, the better. We'll get that information from you, from a number of staff people, as well as myself when I ask those questions and review those with you. Your preparation is best to answer those questions. The other thing you can do is, if you're a person who has symptoms that are not there all the time, you need to figure out what causes those symptoms. It's very frustrating for the patient to come in and say, this is a great day, I feel great, and I tell them they have a very normal knee examination. So if you have a problem that is difficult or doesn't present every single day, then your homework would include trying to figure out what makes those symptoms or that pain come on, and before you come to that office visit, do whatever it is that makes your symptoms come out. Come in with a painful knee, come in with a swollen knee, so that we can see you when you're at your worst, so we can treat you for the symptoms that you are concerned about, not on good days. Now, sometimes you can't help that, but to the extent that you can influence what your symptoms are like that day, please bring in your symptoms. We want to see you when it hurts.